We will call the August 31st, 2023 Benefits and Insurance Committee meeting to order. Call the roll, please, Susan.
Commissioner Boyd. Here. Amber Brown. Here. Suzette Couples. Here. Holly Deering. Here. Brian Gaither. Here. Mary Hickerson. Here. Lois Miller. Here. Commissioner McAdoo. Here. Commissioner Phillips. Here. Shantae Sherrill. Here. Michael Smith. Here. Steve Spence. Here. Sonia Stevenson. Here. Eric Tutobeni. Here.
Thank you. Madam Vice Chair, have you had a chance to review the minutes? We have a motion. Do we have a second? We have a second from Mr. Spence. All those in favor of approving the minutes say aye. Aye. All opposed? The ayes have it. The minutes stand approved. We're now to the portion of our meeting where we will accept public comments for 3 minutes per person. Nobody signed up? Excellent. Item 4, Mr. Elam on financials, please. Thank you.
Yes, sir. If I could have just a minute, I'd like to introduce Jamie Craig. She's our new benefits coordinator. She's also cross-training, so if Susan's not able to make it to a meeting, to be able to fill in for her. So on the 264 fund, you'll see for January, $2,198,392. Expenses a negative $5,924,307. Revenue less expenditures, you see a positive $8,122,699. The total for the calendar year, $12,669,147 in revenue. Expenses, $8,956,226. Revenue less expenditures, you'll see a positive $3,712,921. And for the 2022-23 fiscal year comparison total, you will see a revenue at $50,953,987. Expenses, $49,994,414.
Any questions or comments? I'm not done. Oh, you paused.
I'm sorry. So for the July report for the 264 fund, I have revenue at $1,679,451. Expenses at $1,939,421. Revenue less expenditures, a negative $259,970. For the total for the year, you have $14,348,598 in revenue. Expenditures, $10,895,647. Revenue less expenditures, $3,452,951. And for total for the fiscal year is the same as the month of July, and that is the 264 fund. In the 266 fund for the month of June 2023, you will see $2,655.21 in workers' comp, $36,747.40 for OJI, and for the month of June total, $39,402.61. Year to date, you will see for workers' comp $1,362,328.34. OJI, $607,317.94, and your total for the year is $1,969,646.28, and that was for the month of June. For the month of July, you will see that you have no numbers, and the reason for this for the month of July is because we changed our third-party administrator. And so all of our claims carrying over from the old one in June to the new one in July, you have to have some time to sort through all the files to make sure that people aren't paid twice, and to make sure that the checks that you're writing out and getting everything set up is done correctly. So that's why you don't see anything in the month of July. I will say in August, you'll see a much larger number than average. And Mr. Chairman, that concludes my report.
Thank you. Mr. Elam, Ms. Hickerson, I see your hand raised.
Yes, please. If we go back to the 264 fund in June, where $5,924,307 on expenses. And how do we have that to the good, basically, if you're adding it to the revenue? How do we have that number?
Well, it's a journal entry, and it probably would be a question for Michael on the 260, it's the journal entry on 264 fund for June, the extra $5 million. And part of that is to go into, it takes care of the run out that you had from the schools.
Mr. Smith, would you like to comment? Take your time.
I just know in times past that we've not seen, well, one, that large a sum, but two, I don't know that we've ever seen basically to the good of expenditures. Because if you look at the chart, you're actually running at the expense with it not having those parentheses. You have the parentheses, to me, that's a minus. So if you look at it, that didn't all add up. So what you're doing is you put back $5.9 million, or you've taken it out of the current expenses. So if we need to come back to it, or
Well,
we can't.
I think he's almost got it, so if that's okay. Michael, just do take your time, though. Thank you.
And what I will mention is, in the first months, we had run out, but we didn't have premiums from the Board of Ed. But we expected over 3 months of run out on their claims.
I'm just confirming something real quick, but I found it. No, it's okay. I know why we made it. I just want to read you the right numbers.
Mary, do you have another question for Ed? No, sir. Okay. Okay, so we'll stay right here then. Thank you.
So you're asking, I'm going to clarify what you're asking to make sure I'm telling you correctly. On the 264 report for June 2023, you were asking about the negative $5,924,307. So what that is that's an end of the year adjustment for our IBNR, which is incurred but not reported claims. That's what that stands for. And so what that essentially means is every June, we're going to book an entry up or down on the balance sheet estimating how many claims are applicable to the FY23, applicable to that previous fiscal year that we haven't received yet. Meaning if you went to the doctor on June 25th, Ed's office would not have gotten that bill until sometime July or August. So we're estimating how much that is, right? And so every year, that amount is going to run somewhere in the past $13 to $15 million. If you look back at previous year's claims, that's kind of what the balance we're saying we've received, that bills we haven't received. And it's not just for the month of June. I'm just using a simplified example. So with the schools coming off of our health insurance plan, we no longer have to set that money aside and reserve for claims for the previous year. So that reserve essentially went from $13 million to $5 million. So we actually made an $8 million entry in June to correct that. So it is a journal entry, but to get the balance sheet correct for our claims and judgments payable account at June 30th, to fix that, the offsetting side of that is expense, to reduce expense.
Okay, I guess what kind of throwed me off, if you look up June of '22, we've got we've got 6.5 million in expense, not as an expense going back. So that's what kind of throwed me off as to.
It's
why
an
it was-
end-of-the-year entry. And think of it this way. You know how in the highway fund, you'll have revenue that we estimate coming in at the end of the year, and I book an estimate to make sure we have that? I'm booking an estimate on the liability side of how many claims we're going to get in August, September, and October that are applicable to the previous fiscal year. And it just so happens that this year that amount is really, we do that every year. This year that amount is really large because I don't expect any school claims, from today in August, dated back to June, because they left in January. Yep.
Any other questions for Mr. Elam on the financials report? Seeing none, I'll entertain a motion to accept. We got a motion and a second. This is a roll call vote.
Commissioner Boyd? Yes. Amber Brown? Yes. Suzette Couples? Yes. Holly Deering? Yes. Brian Gaither? Yes. Mary Hickerson? Yes. Lois Miller? Yes. Commissioner McAdoo? Yes. Commissioner Phillips? Yes. Shantae Sherrill? Yes. Michael Smith? Yes. Steve Spence? Yes. Sonia Stevenson? Yes. Eric Tutobeni? Yes.
Thank you. Next is OSHA report.
This is reporting on the month of July 2023. We had 6 incidences in that month, which brings our year-to-date total to 127. Of that 127, there's 85 that were OSHA recordable, with 14 lost day claims, 53 restricted day claims, and 18 other recordables. On the next page, you'll see the comparison of this year's to 2022 of 95 and 2021 of 93. And then the next page is the incurred dollar amount. 2023 is $444,000, with 2022 being at $340,000 and 2021 $378,000. And the last page is the breakdown of the 6 claims. There was 3 at Board of Ed and 3 at County General. And of the 3 at County General, those were at the Sheriff's Department. And that concludes my report.
Thank you. Any questions or discussion for Ms. Thompson? Seeing none, we'll entertain a motion. We have a motion. Do we have a second? We have a second. All those in favor of accepting the report say aye. Aye. Opposed? Ayes have it. The motion is accepted. The report is accepted. We now move to item number 6, the wellness update by Ms. Lovett, Cygnus Wellness Coordinator.
Good afternoon. We are currently at 583 people that has received all 3 points for their incentive points, with the biometrics still running the highest of those that people have gotten for preventative screenings. For our current and upcoming activities, as always, we're doing our monthly podcast. It will go out next week with the trivia questions that go with it for winners. And we are in our 2nd week of our 3rd quarter wellness challenge. It's going really well. Along with that, we have on-site fitness classes that I've been that I offer every quarter. And we've already done one. We have another one tonight, but the first one went really well, had a lot of great feedback. And a couple people walking a little sore the next day. All was good though, all positive feedback. And lastly, we will do, as always, our end of quarter lunch and learn. That will be, I will announce what that will be about at the next insurance meeting. And that concludes my report.
Thank you, Ms. Lovett. Are there any questions or discussion for Ms. Lovett? Thank you very much. Next is Beth Wilson, Manager of Business Operations.
Good afternoon. If you'll please turn to page 3, we'll begin the review of July's data for the MedPoint Clinic. Our visit summary for the month of July 2023, we saw 132 visits, with 111 of those being unique members seen. On the following page 4, visit summary by member type. We saw 15 children, which made up 12% of the visits in the month of July. We saw 100 employees, which made up 75% of those visits, with spouses at 17 making up the other 13% of the visits in the month of July. Our visit appointment type summary on page 5, there were 17 members that had 2 to 3 visits, with established visits accounting for the highest number of those. On the next page, visit summary by day, there were 20 scheduling days in the month of July, 5 Mondays in the month of July. The clinic was closed on July 4th, and Tuesday was the busiest day of the month. On page 7, our in-person versus virtual appointments. We continue to see really low numbers in the virtual space. We saw 2 visits, which continues to show less than 2% of the visits in the clinic as virtual visits versus in person. On page 8, it just gives you the virtual trending summary of in-person versus virtual. And then on page 9, the referral summary for the month of July. We had 16 referrals out. The top 5 were orthopedic surgery, urology, behavioral health, rheumatology, and podiatry. To page 11 for the financials. In the month of July, the total operating cost was $36,999.93. There were 1,930 employees with a PEPM of $19. Our population health analytics on page 13. The BMI summary in July, male highest percentage of BMI was in the obese class 2, and female highest percentage BMI was in the overweight category. Page 14, diagnosis codes. Encounter for general medical exam and pharyngitis, sinusitis were, of course, the top diagnosis for the month of July. We have seen that across the board in all of our AMG clinics. Page 15, our visit demographic summary. In July, 64.39% of the members seen, again, were female. Male age range were 50 to 59, and female age range 40 to 49 was the highest population that made use of the clinic in July. And that concludes my review.
Thank you. Any questions? Ms. Hickerson, you're recognized.
Thank you. Real quick question. I know last month we had to make the hard decision to terminate these clinics 12/31/2023. So we need to be looking at things that we know we're going to have to try to cover or see if we've got them covered in another way under our plans. So what caught my eye on this diagnosis codes, encounter for exam for admission to education. What is that, please, ma'am?
I know, I saw that, and I was like, what in the world was that? That was a sports physical. I know. You are welcome. Actually, I knew you were going to ask that question, so I was prepared.
Any other questions or comments? Seeing none, thank you.
All right, thank you all.
Item 8. Elam, I think we want to have a discussion about MedPoint Clinic Alternatives.
Yes, committee member Hickerson asked me to come with a few alternatives and some thoughts on how we're going to replace the need for the clinics. And one of the things that we talked about last month, MD Live, and looking at for telehealth, and I'll be the first one to say with telehealth, it does not fit everybody, or your care may not be something that you can just snap a picture of and send in to somebody. You may need more extensive care, which would be your primary care physician or a walk-in clinic or something like that. But one of the things I asked, Susan Thompson's pulled the information for me from the Cigna app, and with the in-network results for primary care on the Open Access Plus, there's 492 doctors that are accepting new patients. On the Local Plus network, there's 474 in-network doctors that are accepting new patients. And then we also have, as was mentioned last month, the convenience care clinics. There's 23 of those. So in looking at trying to replace the clinics, I'll be the first one to say, if you're trying to get your points in September and you try to get a physical and call your doctor to get into a physical, for these doctors that are accepting new patients, you might have a little bit of a hard time meeting the September 31st deadline. But I do feel, giving enough notice that the clinics are closing, there are some options out there for primary care physician. And then, of course, your sick visits, you can go to your convenience care clinics, Kroger, Walgreens, CVS, and in the Walgreens, the Vanderbilt clinics. And let me specify, it's not the standalone Vanderbilt clinics, it's the Vanderbilt clinics that are located inside of Walgreens. So, and then when you digest it down a little bit more, you look at it and you see what our utilization is for the clinics and where are those people going to have to go. And so when you look at a total of 1,300 people, and then you look at the utilization on the clinics, it's not as big of a, I think it's not as big of a problem shifting to a PCP or going to use one of the convenience care clinics. I do think that we have the task, our office has the task of communicating very well. I definitely think we do. But as far as filling a huge void, I just don't see that it is there based on the utilization of the clinics. But those are the numbers that Susan pulled up for me.
Any questions? Yes, Sonia, you're recognized.
Of the of the clinicians that are currently providing services at MedPoint, are those, what I've heard from some of the individuals who were concerned about the closures of the MedPoint was they liked their clinician that they were working with at MedPoint. So I guess my question might be if we knew if those individuals were going to still be providing services maybe at the clinics, that might ease some of the people's concern, I guess is what I'm trying to say, instead of having to find a new, because some of the employees are, I would say the repeat people are using this as a primary care of sorts. And so if maybe they knew that the clinician who's been treating them is going to be staying on, that might ease some of the concern, I guess.
Yes, and that's part of the issues that we're having with the clinics is the turnover now, because people know that the contract's not going to be renewed, and just trying to have people fill in. I do know that one clinician that was there for a long time with Rutherford County has left, and also Dr. Gist has left. And I don't know about their contracts, non-compete clauses, anything like that. But I agree with you, if we hear that they've relocated somewhere else, I'd be happy to pass that information along to somebody if they were really happy with their care from that person. One thing I think we talked about last month was for MD Live, and I've got Paul on the agenda if he wants to come up and just review what we had last month with MD Live, and talking about, as I was talking about before, the telehealth. There's a big difference in the cost of if you do it through telehealth compared to going to your PCP, and a huge difference than going to the emergency room. So if y'all want to discuss a little bit of the difference in the cost for a visit or in a telehealth compared to PCP, and why we're looking at a no cost for the employee to use telehealth, MD Live.
Please introduce yourself and who you're with, please. Thank you.
I will, thank you. I'm Paul Huffman, Account Executive with Cigna. So let's look at the continuum of cost across the spectrum. You would put the telehealth MD Live on the far left, okay? And the average cost of an MD Live visit is going to be, I'm going to say, around $55, maybe $55, $60 in total cost. So one of the things being kicked around is incentivizing that benefit, making it at no cost to those that are in the Open Access Plus copay plan or the deductible plan, zero cost. And then for the high deductible plan, perhaps making it 100% after the deductible is met, because the IRS requires the deductible. Moving down the continuum to the right, then you would have convenience care clinics. And we said those are the clinics that Mr. Elam just mentioned that are inside the pharmacies, the Little Clinic, Minute Clinic, and Vanderbilt Health Clinics inside those. Those will vary depending on the services that you get, and it will vary between Minute Clinic, Little Clinic, and Vanderbilt. Vanderbilt's kind of an outlier, but the average cost for the Little Clinic and Minute Clinic are in that $65, $75 dollar range. Okay, so that's convenience care. Moving up the continuing past that, you go into urgent care, which are some of the walk-in clinics that you see. They're brick and mortar buildings, not quite emergency rooms, but just below that. You're going to get in the hundreds, $150, $200 range. Then you get into primary care and specialty visits. Primary care in office, specialty in office, $150, $250. That range, and then emergency room, $500 and above. Okay, so that's kind of the continuum of the price difference and why you would be considering any kind of benefit incentive to have people utilize one or the other. Does that help?
Yes. So with MD Live, we talked about last month, proposal of doing a no cost to the employee. And with those numbers that you see, it's more beneficial to the plan and to the employee for those people that are used to using telehealth, or to try to incentivize them to use telehealth. It's an additional savings to the plan. And there are, like telehealth does not fit every need, but there is something, and I just use an example because I know somebody that's done it, is like if you have shingles, you take a picture, and the doctor goes, yep, that's what you got, and give you a prescription, and you never even have to go to the doctor's office, and compared to going to your PCP, it's half to, could be as much as half to a third of what you go into your doctor's office. So that's why you pass a little bit of that savings on to the employee also by saying let's not, do a copay or, and the IRS, if I understand correctly, the IRS at this point says with a high deductible health plan, you can do that for 2024.
Right.
But there's a possibility that you're going to have to put some type of a cost to it in 2025 and forward.
Yeah, so what Ed is mentioning is that the CARES Act allows the high deductible plans to have telemedicine, telehealth medicine covered at 100%, not subject to deductible, through the end of 2024. So that was due to COVID and when that came out, and so we are not sure whether or not that's going to be continued into 2025 and beyond. So your decision, if you wanted to take away that deductible or waive the deductible on the high deductible plan for MD Live, that could be done for 2024, but it potentially could be something you'd have to take back in the next year and put back in place. One thing I wanted to say about MD Live, so MD Live Telehealth, it's a company that Cigna owns now. We purchased MD Live a couple of years ago and incorporated it into all of our plans at no cost, the administration of it at no cost. It covers really 4 services. So there's urgent care, that's what we're mostly concerned with. That's the after-hours care, sick care, things that, that can be taken care of quickly. Number two is it also includes primary care. So you can actually conduct a wellness screening over the phone and schedule your lab work at a lab, like a LabCorp or a Quest, to have your blood taken and then meet back on the phone to discuss your wellness screening. And that's considered a biometric, and that would satisfy the points in your wellness program. The third thing that MD Live can do is dermatology. So a lot of dermatological visits are not that severe, and some things can be diagnosed with a high-quality picture from your iPhone. And that's what Ed was just mentioning, is that we do have that ability for people to take advantage of that, because getting in to see a dermatologist is almost as hard, if not harder, than a primary care visit. And then the fourth one is behavioral health. We have really leveraged MD Live to increase a network of behavioral providers, and we're seeing a very large increase in behavioral health telehealth visits due to the privacy that's afforded there.
All right. I'm Wes Dozier with Gallagher. Y'all are used to seeing Marissa. But I do come and stand to the side on the day that I need to speak, so y'all can recognize my face. The other item that I think when we're talking about replacing the MedPoint clinics, Paul made mention to it, but it's the wellness, the biometric screenings. We definitely understand that the biometric screenings, doing it through the MD Live is a good option. A lot of people will want to take advantage of that, but we understand that there's a lot of people who probably won't as well. So to replace the biometric screenings, to make sure that employees still have very easy access to the biometrics, we have talked about doing an on-site mobile unit, to where that mobile unit will actually come out to each one of the locations and make it very easy for the employees to have their biometric screenings done at the mobile unit. If a mobile unit is not something that they can attend, let's say that they're not there during the event, then we'll have vouchers, and those vouchers can be used at any LabCorp. There's LabCorps, several different offices around, but employees will have that voucher, and they can do their biometric screenings at no cost there, and they can schedule at a location and a time that's convenient for them. So those are two, for people that were getting their biometrics done at the clinic, those are two ways that we propose to replace that still, I think, keeps it really easy for the employees.
You're recognized, Sonia.
On the, not as much the mobile units, because that's to get your biometrics points and stuff, but on the MD Live, is that for employees only, or is that for anybody who's covered under, like, is it for children up to a certain age, or is anything excluded, I guess is what I'm trying to say?
No, it is available to all members covered under the plan, including children under 18 who would have a parent making the phone call. But yes, it's coverage for the entire population. And one other clarification, it's available on both the OAP plan and the Local Plus plan. Yeah.
Yes, Steve.
Thank you, Chairman. Using the little clinics at Kroger's, how do we go about getting their pharmacy back in network at Kroger's?
Well, if you've got that answer, I would love to know it. We've met, our national contracting department met with Kroger's last year when they decided to terminate the contract. They have not been willing to come back to the table to renegotiate rates. So at this point, Kroger Pharmacy is still out of network and will continue to be out of network until we come back to the table and agree to the discounts that they're wanting or the discounts that we're wanting, and we make an agreement there. But it is not happening at the moment.
Thank you. It's been a concern for some of our employees.
It's a concern for all of us, yes.
Thank you.
Understood.
Yes, Mary.
Okay, a couple of things, but before we get too far from what Wes was talking about, the biometric screenings and coming to the on-site mobile visits and at no cost to the employee, but what does that cost the plan?
So the cost of the plan, specifically on the mobile units, I would have to go back and dial this in, but based on some of the emails, I think the cost of that's about $10,000. That could be covered under the wellness credit. I think there's $25,000 built into the plan for wellness anyway, so the cost of that would already be built into the plan and would be a part of the $25,000.
Okay, is that 10,000 every stop, or is that 10,000 and we make 2 or 3 stops?
That, to my understanding, that's for the event, but I can go, like, for the whole event to all the different places, but I can get clarification for you.
Okay, I can see that kind of working for us as part of a replacement. And then into the MD Live, I think it's a good option, and for the total cost to be $55 to $60. That's total cost. That's not ever how it would shake out to employee or not, or whatever. But the only thing that bothers me on that is I did have a question answered already that MD Live is already there, so we're already paying for it, right, Paul? Kinda. For free. Okay, yeah. So it's already there for free. So then so that makes me feel a little better, because we had 1.52% of virtual appointments through our MedPoint clinic this time, which wasn't even, I don't think, 2 people. I may have missed that, but I just don't see that highly utilized right now. And it's you've got some employees that will, and it's just based on, I don't want to say lifestyle, because that's not quite right either, but it's just some are more comfortable with that could do that. But I'm glad to know that it's kind of what we already have for free, because if we were going to have to pay to have this implemented and then have the cost onto it, I don't see it as any more viable for us, because it wasn't in MedPoint. So just kind of throwing that out there. And for the whole IRS and the pass for the HSA through 24, that would be a good incentive, but then we're going to turn around and snatch that away from them again. So it's almost give them a little bit or charge them just a little, so it's not a big hurt or whatever. It's hard to, like we were talking about giving a pass for the biometric screening on the point system. It's hard to get some folks back after they've done a year of not having to have the points. So we just need to think when we look at this as to the HSA plan. I don't foresee the IRS taking it through 25 or we'll be looking at it each year. If we could set something reasonable and kind of have that go through so that it's not a big shocker come 1/1/25.
I was going to address the comment regarding the utilization of telehealth in the MedPoint clinics. I think that's separate of MD Live, so that's not. We actually, what I'll share with you when I get back to my desk or when I get back to my phone in my chair, we actually have quite a bit of good utilization on MD Live currently. So it is actually already being utilized by your population for your plan, and so that's not reflected in MedPoint reports. So I can give you that. We break it out into 3 categories. One is MD Live utilization. Second is we still have some brick and mortar offices that allow telehealth, and we have a utilization in that too. And then we have a very, very good, significant utilization in behavioral health. So we're seeing a lot of that. So I'll share that with you or send it, after the meeting so that you can see that it is being utilized currently. We just want to, provide a little bit more incentive so that everybody knows it's there and available.
Well, that's good.
Yeah.
That's good, because I wasn't aware that we were, I just assumed that utilization would be similar to the utilization of having the virtual, being able to at the clinic. So that's good to know that we already have people already that are still currently county general employees. So good, thank you. I don't have to know specific numbers, but that's great to know that we're utilizing it already. Thank you.
Yeah, I think a big piece of this too comes to education. Anytime you make any changes whatsoever, education is key. So we already have been in the middle of plans of open enrollment. We're going to be coming on site. Both Anne Marie and Jennifer are going to be coming out to the different departments, doing meetings with all the employees. And this is one of the topics that they're going to go pretty deep into. They're going to lean heavy into it. So talking specifically about MD Live, and that is, I know we've talked about it in the past, but with the clinic, I don't think it's something that was really leaned into. So now in the absence of the clinic, we're really going to lean into the education to make sure people know and understand where they can get those services done.
Sorry, Mary, I can't see you. Excuse me.
That's okay.
You're still
I didn't want to
recognized.
just start talking.
No, that's fine.
Okay, with that being said, and you were talking about the open enrollment and the educational piece, I'm still to the point that I think if we're going to do a huge takeaway of the clinics and still require our employees to get their points to be able to save their $300 in the year, I'm still one on thinking we ought to do a year pass. If we done it in COVID, we could do it now, and maybe it wouldn't be too detrimental. But whatever we do, and I'm up for kind of following this, whatever we do, but the fact of the matter is we definitely need the educational piece to why things are like they are and how things can go, because not everybody understands that they're spending their money when they go to the doctor. Yeah, it's only a $30 copay when I go to my regular physician, but my $200-300, whatever comes out of my check each month, went to pay the other portion of that $30 visit. So, and I know we have smaller numbers this time because it is just county general people are what's left of the pot. So I really would like, Wes, you and Marissa, when you're working on our paperwork and stuff, to be able to explain this and simple, because y'all work in it every day. I got guys that drive tractors. We've got sheriff department and ambulance, and that's their jobs and what they're worried about. So we need to make it as simple as we can, and especially if we're going to make them still required to get the points without giving a pass for them to figure out what's going to work for my life of getting my 3 points or my spouse getting his 3 points also.
Well, yeah, we're in agreement on the educational piece of trying to make it, something that's very easy for them to understand and offer any assistance that we can there. We have looked at the points holiday. That's something in preparation. And of course, standing up in front of a committee, I never want to be disagreeable. But, we took a good hard look at that and kind of going back and looking at the experience from the pandemic. When we put a pause on things, wellness is something that's very difficult to get started, right? So to get the program started, it does take quite a bit. We do have concerns about the momentum loss in a points holiday. The previous information, when we did a pause on that, the participation is still not anywhere close to what it was before. So, that is something that, again, if the committee decides differently, then we're okay with that. But based on our evaluation, it would be our recommendation that we don't do a points holiday, but that we lean into the education and trying to make sure that people understand where the alternatives are.
And if I could just step in just a minute. First of all, I understand your guys, Mayor. I don't think you'd want Wes and I driving a Dozier or a Grader or anything like that. So we understand this, what people's specialties are and how important it is to try to help each other out. And so we'll make every effort possible to do that. The other thing is there's about 887 people, I think, in the 2023 that are getting the discount. And if you took that number and you gave the holiday, that's about a roughly $250,000 plus cost to the plan. And then to come back and add it back in, it would, and then I also know that because of COVID, it was you didn't want to draw people to the doctor's office and stuff just to get points when COVID was going on. And that's when the holiday took place. But now our numbers are down in the 60s, where we were up in the 80s as far as participation in the wellness points. And then the other concern is when you take that away and people don't go, then I think maybe the first year you don't see as much of a issue, but then years later, because they didn't go and they didn't get the blood work and things done that you ask them to do, you see your claims go up in year 2, 3, 4, and 5, and that would be a concern of mine. That on that holiday, you're trying to balance a little difficulty and having to make a change compared to what it costs to the plan 2 or 3 years down the road.
Sonia, you have been really patient. You're recognized.
That's okay. On the MD Live, a lot of times people like to use the same clinician, so does this have the opportunity for that, especially for like the behavioral health? If somebody's seeing, if I'm talking to Mary today and I call back next week, am I going to get someone else? Does that make sense?
Yeah, I think that's a good question. On the behavioral, it does, doesn't it? You can talk to the same provider and have you continuation of care. I think regarding acute instances, you're probably going to get a new one. Yeah.
Mary, please don't tell me you want to ask another question. Commissioner Phelps, you're recognized.
That educational process, most of the time it works pretty well initially, but a month later, 2 months later, especially 3 months later, the average employee still won't forget everything that they learned during that educational process. Is there a way for a continual education process that can be put in place to keep employees abreast of those type of issues?
Absolutely. That's why we've given you a Cigna full-time rep in your office, Lee Smith, and that is her job, is to educate your employees on a regular basis, and she has meetings with all the departments regularly, and this will be part of the key message.
Mary?
Okay. To the educational piece, when Mr. Phillips was talking, when an email is sent out, and Lee knows this, when an email is sent out, it gets copied and stuffed in the payroll checks for my guys, so I get that to them. But something else that really helps us is like a poster of some such that would have pertinent information for longer than a week or two, because we have guys that, they have places they come every morning and every evening before they get to work or before they go home. So just kind of keep that in your mind. I know Wes and them, y'all are new back to us, but this is not y'all's first rodeo in that. So just keep in mind on something like that, if we could have a few, it don't have to be a lot, but if we can have a few of those so we can post around. But then another thing, and I hope I'm not speaking out of turn, but I do think starting in January, we lose our wellness person that I kind of say that helps push the little lunch and learns and the little monthly podcast and things like that. So do we have a way that we're still going to have somebody that, or how can we keep up with that now?
So that's a good question, and I guess that's okay to announce. So in January, Liz Lovett will no longer have a position as the wellness coordinator, and that stems from the loss of the school system. 75% of the volume of work was lost as well. So that freed up Lee to expand her communication role into a wellness role, because she has less departments. She doesn't have to visit the schools and communicate with the schools any longer. So Lee will take over the well-being coordinator responsibilities, and both will kind of be combined, because they work as a team now, and so they share information, and that's a very easy transition and collaboration that she can take over. I'm speaking for you, Lee. Do you want to come up? Okay, you're good.
He made it sound so easy, didn't he?
An excellent discussion. Thank you, Ed. Are there any other questions, comments before we move on? Thank you. Thank you, gentlemen. Ed, I think at this point, we're to item number 9 on our agenda, and that's applicants for the county general employee vacancy effective September 1st, which is tomorrow, 2023.
So we had 2 applicants, and I hope everybody got copies of their applications. It should have been sent to everybody. And the one was Hillary Elizabeth Brown, and the other one was Brian Harold Gaither. Chairman, do you want to ask if they want to come up and speak? How do you want to?
I think it would be appropriate if either one of those, I see Mr. Gaither here, I don't see Miss, there she is, thank you. I think if they came and spoke for 3 minutes, that would be appropriate. So,
Okay.
Ms. Brown, if you would like to come forward and introduce yourself, explain your background, why you would like to be a part of this committee, we appreciate your time. Thank you.
Hi, I'm Hillary Brown. I am 5 years with the county this month. I am in the archives, so you know we do that. I actually, a million years ago, did a little bit of EMT stuff with the county and MTSU through the MTSU program, and I was going to be a nurse, but changed my mind on that track. Currently, my husband works for Cardinal Health. He's a vet. I don't know if that's pertinent or not. We have a 7-month-old who is currently in the NICU up at Vandy. Hopefully she'll come home soon, maybe this month. Well, this month is in September. And I'm a Rutherford County born and raised. I've been here my whole life. So working for the county has just been natural for me, and I do care about like the employees, and you know, I'm the one at work who watches, minus this year, baby, you know, changes everything. But I usually watch all the, you know, insurance meetings and the budget and finance meetings, because I do feel that it is important for employees and citizens to know what's going on with, you know, what impacts us in the long term. And 4 years ago, I was like, one day I'll be on one of these committees. And so I saw the spot opened up and was like, I'll apply. So here we are. But yeah, I really think, you know, I'd bring a different, you know, perspective maybe, and some different ideas, and, you know, just a different, you know, I don't know. Any questions for me? I don't know.
Are there any questions for Ms. Brown? Ms. Brown, thank you very much for being willing to serve. We really appreciate that. That's a big deal. We are constantly, Chairman Phillips and I are constantly having the conversation about how we can get citizens more engaged into committees and the boards. And in regards to the outcome, I commend you for your willingness to serve. So thank you very, very much. Mr. Gaither, would you like to come forward for, I know you won't eat up 3 minutes, and tell us who you are and why you would like to do this, please, sir. Thank you.
I'm Brian Gaither. I'm the EMS director. I've been on this committee for the last 2 years. And a lot of the things that we've been talking about with different education, I think that's why I reapplied for this. You know, we're the second biggest department, and a lot of the insurance educational pieces, sometimes it doesn't get passed down, you know, like it should. So I've been hounding all of our guys, like, look, your deadline's coming up, get your points in, and that kind of stuff. And, you know, I'm familiar with kind of the insurance process, because obviously we bill for all of our transports. And, you know, it's been a different perspective with insurance, with sitting in that chair versus just being an employee and complaining about what the insurance is and different coverage and what's not covered. So I think that's another thing that I can kind of take back to our department to kind of explain, this is what we're doing and this is why we do what we do. Any questions for me? Like the mayor said, I'm not extremely comfortable at this microphone. Thank you.
Thank you, Brian. Thank you very much. Mr. Elam?
All right. So I guess it's time to vote for Mrs. Brown or Mrs. Gaither. Susan,
Mr. Chairman,
or is there any?
I don't know what the
Yes, sir.
proper procedure is, but I'd like to nominate both our excellent applicants, and put both names in the nomination, and then call the roll and vote for one.
Yes, and thank you for that clarification. We were going to do a roll call vote on both of them, but since you've made the point of making a motion, I would like to go ahead and take a second. All those in favor of moving forward with a vote on both candidates, say aye. All opposed, the ayes have it. We will move forward. Thank you, Chairman Phillips. Susan, if you'll call the roll, please, ma'am.
Commissioner Boyd? Amber Brown? Suzette Couples? Holly Deering? Mary Hickerson? Brian Gaither? Lois Miller? Commissioner McAdoo? Commissioner Phillips? Shantae Sherrill? Michael Smith? Steve Spence? Sonia Stevenson? Eric Tutobeni?
Congratulations, Mr. Gaither. You're reappointed with a unanimous decision. Ms. Brown, again, thank you for putting your name forward, and if you would do me a small favor and see me at the conclusion of our meeting, I would very much appreciate it. Again, thank you for your willingness to serve. Thank you. We now move to item number 10 on our agenda. Mr. Elam. Oh, that is me. Well, rats. So we have the reappointment of two at-large members, Holly Deering and Eric Tutobeni. They have. Have they been counseled or prayed over?
Very much so.
Excellent. And so I think what I would like to do at this point is get approval from the committee by acclamation. So if there's a motion to approve both of these and a second.
So moved.
We got a motion from Sonia. Do we have a second? We have a second. All those in favor of approving both these individuals to the committee, say aye. Aye. Opposed? The ayes have it. Susan, did you want to say something? Did I do?
Just make sure who said second.
Oh.
I didn't know if it was Lois.
Thank you. Now we have the announcement of and the selection of the vice chair.
Yes.
Ed?
So, per the resolution that was passed, 3/16/2023, was to select a vice chair in September. And while I was looking through this, I want to bring this to everybody's attention. While I was looking to make sure, we never have been able to find the vice chair's term or anything like that, so that's why the resolution was done. But in my digging, I just wanted to point out, in Insurance Committee meeting on June 24th of 2004, it says, Mrs. Allen asked the committee to nominate a vice chairman to conduct the meeting in her absence. A motion was made by Trey Gooch to nominate Mary Hickerson and the vice chairman. As vice chairman, the motion was seconded by Greg Hall and passed unanimously. So if you just want to know the perspective of how long she has served as vice chairman, it's been since 2004, and I just want to make sure that you understand that this was not done for any type of political reasons other than for procedural, that just to make sure that we had something in there that said when we elected our vice chair. So, and I'm very thankful for the amount of time that she has served. She has served this committee well as vice chair also. And as traffic in Nashville gets from time to time, you do need a vice chairman every now and then because of the way traffic getting back from meetings as the chairman has to attend more frequently.
Well, let me say that for my first year, Mary has done an outstanding job, and I didn't know it was vice chair in perpetuity, but I'm glad to know that. But I think what we will do, Susan, I think the protocol is for between now and the next meeting, if there are other individuals on the committee who want to be considered for that, we will take those in nomination at the October meeting and then September. That's right. I'm still in August. Thank you. At the September meeting, and then we will nominate and vote for our vice chair at the next appointed meeting in September. Is that correct? Perfect. So, thank you, Mary, for your service. I didn't realize it was back to 2004. That's pretty impressive. Nearly as long as Chairman Phillips. Is there any other business before the committee? Seeing none, we stand adjourned.